And now I'd like to invite on stage Congressman Tom MacArthur. He's the co-chair of the Bipartisan Heroin Task Force, a group of more than 100 members of Congress. His state, New Jersey, has an opioid overdose death rate that is 3 times the national average. We're looking forward to hearing from him this morning about strategies and innovative programs that are proving useful in the fight against the epidemic. Welcome, Congressman MacArthur. And Bob, over to you.
How are you?
Good to see you.
Sweet.
Morning.
Thanks for joining us this morning.
Pleasure.
I want to start where I started with Congressman Ryan on immigration. What do you think is going to happen? There's 2 bills going to be on the floor. Yesterday, I had a big meeting with the president. This has been dominating cable news, dominating our coverage. How is this problem, which everyone wants to solve with kids separating their parents, how do you think it's going to get resolved?
Well, there's a few issues in there. I'll tell you what I hope happens, and that is that we pass the compromise bill, because it has been crafted among members from various perspectives. It gets control of the border, I think, in a meaningful way, and builds border security. And it's not a wall from sea to shining sea, but it's a physical barrier in some places. It's electronic fencing, it's drones, it's more boots on the ground. It's a host of things that will help with border security. It gives dreamers a path to legalization without allowing them to jump the line, which I think is important. And it does deal with the family separation issue, which is a tragedy. It requires, one, that children and parents not be separated. And 2, it facilitates the creation of safe family detention centers so that so families can be detained, not just let to enter the country. We've had a 357% increase in the last year in adults using children to get into the country. And that's part of the tragedy here, is that children are being used. We can't just allow anyone to walk across the border because they have a child with them. And so we have to create safe facilities where people with children can be detained and their case can be adjudicated more quickly.
In political media, there are 2 questions that we track. Number 1, who's going to win, and do they have the votes? So do you think the compromise bill has the votes?
I don't know. It's going to be close. Because it's a Republican-only bill, I believe. We'll see if any Democrats support it, but I think it's a Republican-only bill, which is never the ideal.
Right.
I think that makes the path more difficult, and we'll find out on Thursday whether there are the votes. I hope so, because this is a tragedy we have to solve in the immediate sense with the family separations. But beyond that, you have 800,000 young people that are in DACA now, and they're being twisted in the wind. It's not fair, and I'm blaming both parties, not one party. I think there are Republicans who want to just have their way on this and have closed themselves off to giving any path to these young people. And there are Democrats that are quite content to see them twist in the wind until November so they can make an issue out of it. I don't want an issue, I want a solution, and I think that's where people should be in Congress, in both parties. We should have a solution that gives these people some finality.
On opioids, and we have a lot of events on various issues, and opioids is one that I think is certainly the most serious, because we're talking about lives, and we're talking about over 100 people dying a day. What is the situation in your district? What do you see that a Washington audience should know?
Well, I think you use the right word. These are persons, and you get lost in the statistics. We're losing 1,200 young people a week, which is a crisis and a tragedy, but every one of them is a person whose life has been stolen from them, and there's collateral damage all around them with their loved ones and others who've been terribly hurt by this. I have not lost a child to addiction, but I've lost a child. And I know the pain of having a child die as a child. It's heartbreaking. When I have parents come and see me, and I have many of them, and tell me their stories, it's heartbreaking. That's what got me involved in the Opioid Task Force, and ultimately I became the co-chairman of it. It's people, it's lives. I lost a dear friend to addiction 8 years ago, and I was at his daughter's wedding 2 weeks ago. She was 13. when he died. That is just a tragedy, as I've watched a family struggle with the loss of a loving man, a good man who got trapped in addiction. And that's the way I think we need to look at this. People, it's not just a moral failing. Sometimes people make bad decisions. Sometimes in this current crisis, it's increasingly been a prescription was given to them and led to their addiction. Dr. Nora Volkow leads the NIH Center for Addiction, and she's testified at our task force hearings that upwards of 80% of heroin addicts today got addicted through pain pills, and many of them through legally prescribed pain pills. That's where we need to, I think, address our efforts and how to curb that. And I see the name of your conference here about the use of technology. Technology can really help us, I think, get in front of this.
How so?
Well, a couple of ways. One, we need to move prescriptions to electronic prescriptions because they're far more easily monitored and tracked. I think that is long overdue, and I think that's one thing that'll come out of this process now. It'll come through the House and go to the Senate. I think another, PDMPs, prescription drug monitoring programs, they are helpful, but the limitation has been that some states do it really well and some states barely do it at all. And there's a lack of interoperability frequently between states. There's delays sometimes. Some states give their doctors a week to report. You know, a heroin addict could have seen 50 doctors in the surrounding areas in the space of that week. So I am looking at, and I expect to introduce this shortly, there is an enormous amount of data already available that doctors would not have to enter separately, available in the Medicare claims system, private insurance claims systems. All of these entities that are paying for prescriptions already have records. And I want to try to get a coordinated concentration of all of that data so that doctors can get alerts, red alerts when the data
About their patients.
About their patients without violating privacy, but the system can analyze whether there's a trend that is of concern and give a prescribing doctor a heads up that there's a problem. That's a technological solution that there's no other way to do that other than through technology.
There's been a lot of bills that you've co-sponsored that are moving on opioids. You alluded to it earlier. There was bills last night. What is the plan to consolidate these bills in the House, and then what's the plan with the Senate? I know House Republicans love the Senate. You know, how quickly can the Senate act is the question.
Those are good questions. We have about 50 bills working their way on opioids, working their way through the House last week and this week. One of the two we passed last night was mine, actually. The Senior Communities Act gives Medicare another tool for stopping payment to pharmacies that are under investigation for abuse.
Right.
And so I think that's an important step. I would characterize these 50 bills as rifle shots for the most part. They all solve some specific area of need. They're not broad funding bills. We did that earlier in the cycle. We funded through the omnibus of $4 billion. We've added funding for research and development for how to combat the crisis. We've beefed up the high-intensity drug trafficking area funding. We've beefed up the drug-free communities funding. These are not funding bills. They're policy changes for the most part. And they deal with a range of things, all pointed at prevention, treatment, recovery. There's a number of focus just on the fentanyl crisis, which is growing. And we will bundle all the bills that pass into one vehicle that's already been created. It's H.R. 6. It has a name. I forget the name. But the bills will go into that. They'll get organized in some fashion and go to the Senate because the Senate seems to have trouble doing more than one thing at a time. So we'll give them one bill with a lot of pieces to it. And our hope and expectation is that they'll take it up during July or August.
Okay. And do you think that, I mean, this issue, as you said, there has been legislation passed. But do you think that the president needs to talk about these bills? Because they're not getting certainly headlines this week that he needs to tout it.
I'm less concerned about headlines, to be honest. Right now, I'm concerned about solutions. There's plenty of time for, foot stomping and flag waving and saying, look what we did. The reality is, while these bills are important, while they're meaningful, and while they'll save lives, there's no silver bullet here.
Right.
And there is an enormous amount we still have to do. So I'm not worried about these bills because we don't need the White House to get them passed.
Right.
They're going through the ordinary course.
Bipartisan.
There's good
right.
bipartisan support for them because this is not a crisis that knows political boundaries. It affects everyone. And so we'll get these done. We need the president more on immigration, frankly, because I think he could tip the balance
Right.
in the favor of getting something passed.
Legislation gets a lot of attention, but then there's also the implementation of it and the policies that the administration must carry out. What do you think the Trump administration on opioids has done well, and where could they do a little better?
Well, they have been committed in terms of resources. The president asked for $6 billion in his budget, which is more than any president has ever asked for this kind of a public health crisis. So I think they've done well in that. There's been decent coordination from the Office of National Drug Control Policy, ONDCP. In my own area in South Jersey, we were named a HIDA, which is an unfortunate distinction, to be named a high-intensity drug trafficking area, but it brought us a lot of resource, and we ended up about 6-8 weeks ago doing the largest bust in South Jersey history, confiscated 91,000 doses of heroin, a lot of other drugs, a lot of money, 28 vehicles, a lot of guns. We would not have done that without federal help from the DEA. I think where they need to do better, this is the second year in a row that me and others have had to push back against the administration for trying to sort of dismantle ONDCP and send the Drug-Free Communities program to HHS, send HIDA to Justice. Thank you so much. I understand why they're doing it, but we're in the middle of the worst drug crisis in human history. This is not the time to take chances. And while it might work out, it might not work out. There might be a hiccup, but we can't afford a hiccup. So I went to Mick Mulvaney, who's a friend, and the president's OMB director, and said, Mick, I'm going to resist you again, and the task force is going to resist you. And we did successfully. Second year in a row, we've said, no, you cannot dismantle ONDCP. The single agency of the administration focused on coordinating. You have SAMHSA does a lot of good things too, but ONDCP coordinates across state, federal, government, not government, coordinates all of that policy so we get our best effect, and I don't want to do anything to monkey with that right now.
What can stakeholders do, both at the federal and the state level? I was noticing the New Jersey Hospital Association has a new tool, but what can providers do? Because as you know, in this town, providers fight each other and finger point.
Well, it's not limited to providers in this town.
True.
Politicians do the same thing. I think everyone can be creative and realize no one part of our society has an answer to this alone. No one part can beat this. We can beat it if we work together. And different entities can come out with solutions that nobody would have thought. I'll give an example. I was asked to go up to Hartford Insurance Company in Hartford, Connecticut about a month ago. They wanted to show me what they were doing to combat the opioid crisis. They are the second, if I remember right, the second largest writer of workers' comp insurance in the country. And I am maybe the only member of Congress who has run an insurance company. I was a businessman my whole life, and I ran an insurance company. They wanted to show me what they were doing. It was fascinating to me. This goes back to that idea I mentioned a few minutes ago about getting claims data that already exists rather than having doctors report it into a PDMP. Hartford pays out $12 billion a year in workers' comp claims. They have an enormous amount of data in their system, and they are mining that data. They're using artificial intelligence to analyze conversations between their claims people and claimants. They're looking for red flags, and when they see something, when the computer sees something that suggests a problem, now or a problem that could be in the making. They have teams of nurses that intervene. They have teams of doctors that look at prescriptions. They have brought the use of opioids down by 40% in the last couple of years on their workers' comp claims, which saves lives, helps people avoid addiction, saves the Hartford money because people are getting back to work more quickly, saves those employers money, and most importantly, gets those people back into a productive life rather than being at risk of being trapped by addiction. This is one company realizing that they had inside their company an enormous amount of data without violating anyone's privacy. They can use AI to analyze that and figure out how to save lives. That's brilliant to me. That is just brilliant. And you think about stakeholders in this room who likewise have a window into some particular part of this crisis, and I think there's a great opportunity for different people to solve different parts of this.
We have a few minutes left, so we'll open up for questions. If you have a question, please raise your hand, and the mic will come to you. We'll go up here in the front. Oh, hold on one second until we get the mic, because we're live streaming on thehill.com.
Thank you, Congressman MacArthur. My name is Jacob Rich, and you discussed coordination with the DEA, and Congressman Ryan brought up legislation to force doctors to participate in prescription drug monitoring programs. How do you balance this policy with patient and prescriber privacy, since prescription drug monitoring programs are not subject to HIPAA protection, and the Controlled Substances Act gives the DEA jurisdiction to circumvent the Fourth Amendment to raid PDMPs with internal subpoenas without a court order?
Privacy is a double-edged sword. I support it, but it's actually one of the greatest impediments in solving the drug crisis, because behind the wall of privacy, people that have become addicted are going to see dozens of different doctors, dozens of different hospitals, filling prescriptions at dozens of different pharmacies and others, and it's been difficult for all of these people to communicate and coordinate. This is where I think technology can play a role. Privacy is not lost when you have artificial intelligence examining data and sending up red flags. I don't think that's a violation of anyone's privacy. And I think it's important that we find ways, and I think we can find ways, where people's information as it relates to their own safety and solving a societal crisis can be analyzed without that individual's medical records being broadcast on tomorrow's headlines. I think we can achieve both of those. But I do think we have to accept that there has to be some limitation on this. I'll give an example. In my home county, Ocean County, the prosecutor's office has done a terrific job of helping people through various streams walk into police stations, connect with recovery coaches in the hospital, lots of different ways to get them into recovery, into treatment and recovery. The very first thing they do is they ask the person to sign a HIPAA waiver. Now, you can argue about the pros and cons of that. For me, they're saving lives. And so I support that. I support that endeavor. I think we can do that even more safely through the use of technology.
We've run out of time. Please thank the Congressman for joining us this morning. Thank you so much.
Thank you.